Hello, and welcome to the Alcohol Awareness webinar. I'm Helen Smith, one of the medical advisors at the Trust. I'm very grateful to Don Schenker from the Alcohol Health Network, who presented the original webinar in November 22, and who kindly agreed to share his knowledge and his slides with us. Alcohol Health Network is a social enterprise, and it promotes alcohol awareness and enabling people to enjoy a drink in a healthy way. If you're particularly interested in their work, then there's a link on the slide just here. So this webinar covers messages around how alcohol affects us both physically and emotionally, talking a little bit about safer drinking, creating a healthier balance with alcohol, ways to stay in control of drinking and supporting the support that's available to help us maintain that healthier lifestyle without necessarily giving up alcohol completely. Also, a little bit about what are the signs of drinking harmfully, what alcohol can do if you're drinking a little bit too much, and supporting somebody that you might be concerned about. So humans have been brewing alcohol and presumably drinking alcohol since at least 7,000 BCE. It was first discovered in China many years ago, but we've been brewing it this long. So why do humans drink alcohol? We like the flavor. It's a reward for achieving something. I deserve that drink, right? It's used in socializing, celebrating, everybody else is having one. Relaxing, helps me just to wind down at the end of the day, helps me to get to sleep. Sometimes boredom, nothing else to do, might as well have a drink, watch TV. Is it just the one? Does that one have company? Can't switch off without a drink in the evening, helps me to forget about the pain I've got, helps me to forget about sad times. And it's because of all of this that people have such a complex relationship with alcohol. It can be happy times with family, it can be out with friends, it can be birthdays, other celebrations, but if we overdo it, there are significant problems associated with that. So here we've got a picture of people who are unconscious having drunk far too much. Guidelines for safer drinking were updated in October 2020. And the recommendations are now the same for both men and women, which is a maximum of 14 units per week, spread over 3 to 4 days, with at least 2 alcohol-free days per week. So not saving up all of those units for a binge at the weekend, spreading them out, but making sure that you have a gap in your drinking so that you're not drinking absolutely every day. So alcohol affects the whole of the body. I don't know how well you can see the slide, but it's saying about the liver, blood pressure, increases your risk of stroke, depression and anxiety, various different types of cancer. But people underestimate how much they drink by approximately 60%. This is down to a University College London study, which suggests that people really don't know how much alcohol they're actually drinking. So how do you know what's in your drink? Most people might think that a glass of wine is about a unit. And that used to be the case when glasses of wine were small and wine was weaker than it is now. But over time, wine and beers have got much stronger. And that means that the amount of alcohol in each drink that we're having has gone up. So a standard glass of wine, which is 175 mils, is actually 2 units. And a large glass of wine in a pub is going to be 3 units of alcohol. A pint of premium cider, 3 units, the equivalent of a large glass of wine. And a can of premium strength lager at home is going to be approximately 2 units. So there may be slightly more alcohol in each drink than people are realizing. And that's really important to make sure that you know how much is in a drink, and then you can count how much drinking accurately. So looking at the current guidelines, so the government spread it into low risk, increasing risk, and higher risk. And your low risk is about 5 alcoholic drinks spread over 3 to 4 days in the week. If you're drinking more than that, so perhaps 1 to 2 drinks every day, then you're probably at increasing risk. And you'll notice here that the men and the women are slightly separated in that men are considered increasing risk up to 50 units and women up to 35 units. So slightly increased risk, particularly if you are drinking every day. And then if you're drinking 2 to 3 drinks or more than that every day, if you're a man, or 1 to 2 drinks every day if you're a woman, you are at higher risk of damage to the body due to drinking more alcohol than is recommended. So thinking about the whole of the body, drinking alcohol affects all the organs. It increases your risk of cancer. It has a big impact on our weight. So alcohol's got a lot of calories in it, so we can find that we put weight on if we drink too much. But if you drink and you don't eat, you can then start to lose weight and your muscles can get quite weak. So it's really important to make sure that you're eating healthily if you're having an alcoholic drink. It affects the skin. It starts to dry the skin out. So you do get wrinkles a little bit earlier. It causes you to have higher blood pressure. That in turn can increase your risk of stroke. And it also affects mental well-being. We'll touch on that in a bit more detail later on. So here we are. Alcohol is a depressant drug. It affects the brain. So initially it starts us to makes us feel a little bit more chatty and a bit more relaxed and sociable, but actually more and more of it, and it starts to stop the brain functioning properly, and you can become angry, agitated, depressed, very anxious. It affects your sleep. It affects the heart. So long-term drinking doubles your risk of heart attacks and heart disease. The more you drink, the more chance you have of flipping the heart into an irregular rhythm, which can cause all sorts of problems. Drinking double the recommended guidelines, so that's into the sort of increasing risk category we were talking about a moment ago, actually doubles the risk of high blood pressure in women and makes it 4 times more likely in chaps that you're going to get higher blood pressure. It affects the way the liver works. We'll go into that in a little bit more detail a bit later on, because the problems that are associated with the liver are often hidden and you don't know about them until there's a big problem. Drinking more than recommended can increase the risk of cancer, particularly liver cancer, breast cancer, and pancreatic cancer, but there are other cancers that it affects as well. Alcohol has a big impact on our mental health. There's a strong association between alcohol and mental well-being. You get that initial relaxation, buzz, that sort of sensation that, oh yeah, I'm feeling quite good here. But actually we forget that alcohol is a depressant drug and it is switching the brain off. It's used a lot for coping with stress and anxiety and fatigue and helping you to relax at the end of the day. And also, some people use it as a pick-me-up. So you think, well, you might have a cup of coffee or a biscuit, and other people will reach for a glass of wine or a beer and think, oh, that'll make me feel much better. But actually, in the long term, it's having a much bigger impact on our bodies than we realize. And you can get into very fixed patterns associated with alcohol. It's an addictive medication drug. So like any other addictive thing, nicotine and codeine, for example, the more you drink, the more you need to drink to get the same effects. And therefore your use of it starts to build up and up and up. Coming on to alcohol and sleep. Alcohol makes you sleepy. If you drink more, you're much more likely to feel that you're sleepy and that you might get off to sleep easily. But it's not a natural sleep. And one of the problems with using alcohol to get you off to sleep is that becomes very habit forming. You then find that you go into a deep sleep far too early, and that plays havoc with your sleep cycles. So you don't actually get a good natural sleep. You wake up at all the wrong times, and it's a diuretic, alcohol. It opens up the blood vessels. It makes your kidneys work a bit faster. So you pee more. You have to get up in the night to go to the toilet. Then you wake up dry, dehydrated, headache. Everything's just sort of dried out, and that in its dehydration also has a negative effect on health and well-being. So one of the most important things about alcohol, if you do drink alcohol, then if you can, try and sober up a little bit before you go to bed and drink plenty of water. Yes, the water will make you need to wee more, but you won't be so dehydrated in the morning. It won't have such a profound effect on you, and you won't feel quite so hungover the next day. So I'm going to come on to the effects on the liver now. So the liver is the largest organ in the body. It sits on the right-hand side of the tummy, just underneath your rib cage. And it's full of lots of enzymes that clear all the toxins out of the blood. So it works a little bit like a filter, clears out the rubbish, and it allows all the clean blood to flow back around the body. If you are drinking moderately or higher risk drinking, that can increase the fat deposits in the liver tissues, and that stops it working quite as well. So you won't notice anything's wrong. It's still working, but much more slowly than it should be. So it's working like a partly blocked drain. Everything goes through, but it trickles through at a slower rate. You might feel fine. It might not show at all. It might show up in blood tests if you have those done from your doctor for any reason. At this point, if you reduce the amount of alcohol that you're drinking, or you stop drinking alcohol altogether, then damage to the liver can be reversed. But longer term damage, more and more of that fatty tissue can get deposited into the liver tissues, and then the tissues become inflamed and start to die off. That then leads on to cirrhosis of the liver, and the liver then becomes very stiff and solid, and it stops working as a filter. So it's like a blocked drain that's now overflowing. That's leading to liver failure. And the toxins and the things that the liver are clearing out from your system are then building up in the bloodstream. So you'll see that in signs of liver blockage. So jaundice is the classic sign, where the whites of the eyes go yellow, the skin can take on a yellowy tinge, you start to itch a lot, and your wee goes really dark because the bilirubin, which is building up in your system, is coming out in the wee instead of being got rid of by the liver. You might find that your poo goes very light and doesn't flush away terribly well. You can get really weak, very confused, and sudden buildup of fluid in the belly. So where you don't have a normal flat belly and it all just suddenly bloats up, but it won't go away, doesn't go down overnight. Swelling in the ankles, bit of fluid buildup in the whole of the legs. These are all signs that the liver isn't working, and that's a real medical emergency. About 2/3 of people with cirrhosis actually only know about it when they develop full-blown liver failure. 15% of people with cirrhosis develop liver cancer, and the average life expectancy after liver failure is only 2 years. So the important thing is to catch it well before you get to the stage of liver failure, because then it's still reversible. Once you've got to the stage of liver failure, you can get your liver working again, but it's never going to work as well as it did, and you're going to have to stay off alcohol completely at that point. Drinking within safe limit can really help, because damage to the liver and most of the other organs can actually be reduced or reversed by reducing your alcohol intake to safe levels or stopping drinking completely. And some people find it's easier to say, actually, I'm not going to drink at all, than it is just to stick with the within the limits of safer drinking. Reducing alcohol at night, as we've mentioned, can improve the quality of sleep. which gives you much more energy to manage the next day. Might find that your sleep doesn't feel as good to start with because you're used to using the alcohol to get you off to a heavier sleep start. But over a couple of weeks, once you've reduced that alcohol down, you start to feel much more positive and brighter and clearer headed. And that in itself can actually make you feel much more positive and happier in the long run as well. So there's loads of real positives about sticking within the safer, healthier limits and trying to reduce the amount of time that you spend drinking over the recommended limits. If you would like to check your drinking privately, if you go to the Drink Checker app website listed here, then that will give you an idea as to whether you're drinking within the safe limits, slightly higher risk or very high risk levels. It's completely anonymous. It's not linked to anything, so nobody gets your data at all. But it can give you a really good indication as to how much drinking and whether you would benefit from making any changes to that. So you're looking at how much do you drink, your level of risk, am I drinking within the guidelines? And remember, those guidelines have changed. And it also gives you some tips for keeping yourself at lower risk as well. So how do we think about changing the amount of alcohol that we're drinking? Because it does become part of everyday life. And that can be really difficult to change. First thing is knowing how much you're drinking. So we've talked about how many units there are in a glass of wine, how many units there are. We do have one of those drink checker charts available on the website. So we'll make sure that that's available for you to be able to check on. There's lots of them available online as well. So understanding your guidelines, knowing how much you're drinking, and then you're in control all of the time. Do you always drink at a set time? So do you always have a drink when you're making dinner, or once you've cooked, sit down and have a glass of wine with your dinner? Do you have a drink in the evening when you're watching telly? Can you do something different? Can you make a change so that not every night do you have a drink at the same time? Do you drink on an empty stomach? Because if you do, if you can drink with food and water, you'll be significantly reducing your risks. You won't want to drink as much because your tummy's a bit more full. You're rehydrating yourself with that water, which helps everything to clear out faster. And because you're taking on the food as well, it slows down the absorption of the alcohol slightly. But more importantly, it gives you all the nutrition that you need. And you don't try and take all of the nutrition out of the alcoholic drink and just rely on that. We talked about, do you drink every day? Can you have some days off where you don't drink alcohol? Can you swap it for an alcohol-free drink? Doesn't have to just be tap water. There's lots of different options out there. So you can have something that tastes very like an alcoholic drink, but is a low or no alcohol option. I know there's loads of different varieties of low alcohol or no alcohol beers and wines, but there's all the soft drink alternatives as well. So see what you like, see if you can find something that you can spread that alcohol out with so that you're not just drinking the same thing at the same time every day. And then thinking about other positive changes you can make just to keep yourself happy and more positive, and perhaps break some of the less healthy habits. Connecting with others. Can you phone a friend? Talk to a family member? Cuddle the dog? All of these connectivity activities make us feel more positive, make us feel happier, and then you're much less likely to turn to alcohol because you feel that it's your only friend. Find another way of expressing that need for self-care with others, and that can make such a positive difference to you. Likewise, your physical well-being. Can you find a way of doing a little bit of exercise? It doesn't have to be going to the gym or going for a run. I'm thinking about perhaps a few chair-based stretches. You might just want to stretch your neck a little bit, just so that it moves around. Move your shoulders if you can. A short walk or just a stroll up and down the sitting room if you can make such a difference than just sitting in the same place all the time. So regular movement rather than big exercise. It's a snowy day here today, so probably not going outside, but sitting at the window and admiring the beauty of the world out there is definitely worth doing. Finding something positive about each day. Learning something new can be a really good distraction. So it may be that you want to read something that you've not done, learn a song that you've heard on the radio, find something that you're sort of slightly excited by and learn a little bit more about it. Can make you feel really positive. Practicing kindness to others is really important. So if you've got somebody that you can connect with, just give them a smile, say hello to them, find some way of connecting to them. But most importantly, be kind to yourself. So don't try and make everything out. You've got to have everything perfect. Try and be as gentle and as kind to yourself as you possibly can. And that will help the world go by and each day be a little bit more positive. Noticing what's going on around you, how you feel, and how alcohol makes you feel, how being with others makes you feel, that can all have a big impact on the positivity of life. And the other suggestions that we have is perhaps try and find something that's a way to make the beginning and the end of each day quite positive. So at the moment, reading the news perhaps isn't the most positive way to start a day. Perhaps you can find something else that you can enjoy at the beginning of the day, and likewise at the end of the day. It may be reading a book, it may be listening to the radio, possibly not the news. Find the positives in things and just make sure that you thought, actually, there is some good in the world out there, and I've found these positive things in the day that can make me feel good about the day and a little bit about myself as well. And that can make such difference to how everybody feels. And then you're much less likely to run into habits that perhaps are harder to break. Moving on to supporting somebody else that you might be concerned about. So some of the do's and don'ts around looking after somebody who may be perhaps drinking more than recommended or that you're worrying about. Show concern for them. Be specific about it. So say I'm really worried about the amount of alcohol that you're drinking, but don't get into an argument. So it's more about explaining that the alcohol is causing difficult behaviours, but it's not putting that as a problem with the person. It's the behaviours that's concerning. Talk about how you feel about it. You can offer to help, ask what help they might want, provide resources. I'm going to give you some information on the slide in a minute of what's available to help people. But let people take their own time over when they feel ready to accept the help that's offered. And sometimes people will do really well for a while, and then something will trigger a bit of a problem, and they might slither back into older habits. But once you've actually made positive change, you know you can make that positive change again. So don't ever see it as a failure if somebody goes back to drinking more than ideally recommended. They can make those positive changes again with encouragement and support. So support options that are available for us. There's confidential advice via Drinkline and the telephone numbers here. There's online advice via the Live Well Alcohol Support. There's Alcoholics Anonymous and Smart Recovery. There's the Alcohol Health Network that we talked about. They have various different online support information, and they will do some email support as well. So they'll send you the daily tips on how to keep your drinking within healthy limits. There's lots of apps that you can have on your phone, which will track how much you drink if you put the details in, and will give you positive prompts to make sure that you're sticking within the limits that you've set for yourself. You can find local alcohol services either via the NHS service, as it says here, Google find an alcohol service. Your GP will know about the local services that are available. And please do remember that the medical advisors are always happy to talk to you, and all the staff at the Trust are here to support you. So I hope that's been helpful. And if you've got any questions, please do get back to us at the Trust, and we will do what we can to support you. Thank you.